Well, multiple federal agencies are facing mass layoffs in light of the Trump administration's efforts to downsize government.
And these layoffs reached the Food and Drug Administration this past weekend, and our Meryl Hubbard found they hit close to home. She's here to show us the local effects of these layoffs.
Officials say the Department of Health and Human Services is estimated to lose about 5,200 probationary employees. One Madison man is already out of a job as his lifelong career came to a halt this past weekend.
To have it pulled out from under you very suddenly is crushing.
Dr. Matt Minnick found out his job was pulled out from under him on Saturday.
Obviously, it's sad for me, and it's sad for my colleagues who have lost their jobs. But I think it's also sad for the American public.
Dr. Minnick worked for the FDA Center of Tobacco Products, working on anti-tobacco campaigns.
The people who are being fired are people who have devoted their lives to keeping your kids healthy.
He says that 4 other employees in his cohort were let go. All of them, including himself, are probationary or relatively new employees, and all of them got an email. His reads in part, quote, "The agency finds that you are not fit for continued employment because your ability, knowledge, and skills don't fit the agency's current needs." How do you receive any warning beforehand that you weren't meeting those standards?
No. The performance claim is untrue. I had received an above, expectations performance review in the one performance review that I had.
He called it boilerplate language, and when I read this email to UW law expert, he called it messy.
Probation employees do have protections under federal regulations about being fired, and that's where this language gets so interesting.
Howard Schwaber is a professor emeritus of political science at UW-Madison.
So where we have these probationary employees who say, look, I've had excellent reviews, and this notice says I'm being fired for poor performance, there could be a legal claim there.
But for now, Dr. Minnick is less worried about a suit and more concerned about the rug being pulled out from people who need health resources.
I don't know what the public health fallout from this will be. I trust in the people who are still there. They're very, very capable. But it certainly will not make America healthier.
I asked Dr. Minnick if he received any sort of severance pay, and he replied 1 month pay and benefits.